Good evening, good afternoon, and good morning. This is the 2183rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Paul Joseph from Canada. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of today is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have a local Malayalam session, in the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again and subscribe the same without paying any money. We have already uploaded more than 4,000 videos. So it's a Guinness record as far as homeopathy is concerned. Nobody has done such a wonderful job here. You can see that means more than 400 hours of homeopathic education and propagation. So that's what we are doing. We are able to connect with doctors from more than 65 countries and presentations from homeopathic doctors, homeopathic lovers, and well-wishers, and even eminent personalities from different part of the world. And the purpose of this forum is to take homeopathy to every home around the world. And that's what we are doing regularly. And as you all know, today our guest is Professor Dr. Paul Joseph. All of you may be quite familiar with Dr. Paul Joseph because he is a person who is doing regular presentations in this forum, and all his presentations are really excellent and of a different variety. And Doctor has completed BHMS and R.Hom Canada and PG Diploma in Acupuncture, practicing in Toronto, and former professor, Homeopathic Medical College under Tamil Nadu MG University, and author and writer of various medical articles and published 2 books on health and Kavide, that's on poems. Radio host during talk shows on health and politics in Geetavani for 15 years and doing talk show on health and tech TV for last 10 years in Canada. Today, Doctor will be talking a very important subject, that is SCIATICA, a homeopathic experience. That means how a homeopathic medicine works in a sciatica case, which is supposed to be a very difficult to cure case. So let us see what Professor Paul Joseph has to say about this. Welcome, sir.
Is it audible?
Yes, yes.
My video and everything is okay, right? So, special greeting to everyone, those who are in the platform, especially IFPH, International Forum for Promoting Homeopathy, as Dr. Danesh said, right? Almost 5 years, right? Isn't it? Yeah, now we are going to complete 5th year of this platform. So as he said, many specialities and many expertise, those delivers lectures on this platform. And as a student, as a practitioner, as a students of homeopathy, we learn a lot of things from this platform. So always be thankful to the IFPH, and especially the doctors, those who are attending daily, especially Dr. Ram Pravesh, even his busy practice. Really, doctor, I appreciate you and other doctors too, the especially organizers. So today's topic, why I took this topic, because it's a very difficult. Most of the cases, low back pain, sciatica, and this kind of cases come. They don't come usually directly to us, even in India and the other countries too. Why? Because it is a severe acute pain, and most of the patient, they went to allopathic doctors or Western medicine or orthopedic or neurosurgeon or physiotherapy. So they won't come directly. But here the problem is different. Some of the 50% of my total patients are having the same problem, similar problem. They come with a similar problem. I can say 50%. Around the 50%, maybe 40% of cases are the sciatica syndrome. So some of them I provide my specialty acupuncture and homeopathy both. But some of the patients, they won't take acupuncture because of the needle. So for them, I prescribe homeopathic medicine. So I would like to share my experience and stories of some of the patients and the methodology which I apply to these type of cases. So I would like to share how I cure these cases with homeopathy. The first case, I can show you. So sciatica. This is the pictures I took today morning in front of my house. See the the Canadian summer, how it looks like, right? See the color of the beauty of creation by God. You can see different. This is this.
Yes,
See
yes,
how
yes.
it looks like. All are that the sunflower, right? Usually in India we have the yellow color one. Here, see the different colors. Right. So this picture, I just while coming from my home to clinic, I took these pictures and I wanted to show you the color and beauty of the nature. So like that, the homeopathy, you can see here, you can see like a flame, right? The another, see, that's yeah. These are all in front of my home, my garden. Here you can see the fiery kind of flower. Right. The sciatica is the most frequent radicular pain. It's a syndrome. It's not a disease. Sciatica is not a disease. Right? It is a symptom or syndrome. A group of pathology or group of disease may reveal this kind of or may produce this kind of the symptoms. It occurs due to irritation and or compression or the pinch of the spinal nerve root associated with the especially disc herniation or maybe different kind of pathology. But at the level of the root, L4, L5 or L5, S1 or S2, S3 too. The pain usually begin in the lower limb and back and radiating downwards through it's run through the gluteal region, sacroiliac region, buttocks and thighs and behind the knee and cuff and until the feet. So as I said, it's a symptom, it's not a disease. the cause of the sciatic nerve. I think many of us, we studied, I don't go into deeper, right? Its origin from lumbosacral plexus, and right, it then enter into the gluteal region via greater sciatic foramen, and emerged out inferior to the below the piriformis muscles, and it runs on the course until it has different branches, but the real the sciatic nerve termination end in the popliteal fossa, and it become a tibial nerve and common fibular nerve. You know the stories like that. So these are L4 and L5, S1, S2, S3. These are the root. Sorry. So why I am explaining all this? Because the pathology or the background of the stories of the patients, it gives you clue to the diagnosis, and also clue to the remedy selection. That is very important. So today we are going to discuss about how I select the remedy on the basis of the pathology and the patients. Here you can see the another. So in our lower limb, not only the sciatic nerve, there are a lot of nerve innervations are there, right? Apart from for example, the femoral nerve and obturator nerve and different kind of nerve innervations. But the sciatic nerve has two functions mainly. One is the motor function, the other one is sensory function. The sensory functions are little hidden one, so it indirectly the sciatic the nerve innervation of the lower limb sciatic part, it has a hidden the play a role in the sensory function. So those things we are going to see, especially tibial nerve and common fibular nerve, they act as the sensory. It's come from the feet and the leg and the other parts of the body. Sorry, it goes to the spinal cord and it goes to the brain, right? So before that, we'll discuss about one case and we'll come to the other. Yeah. Okay. This is visible. My slides.
Fine.
Is it right?
Yes, visible.
Okay. So this is a very simple case, but it's for us it's a simple case. But for the patient, right, it's a very excruciating pain. Right-sided lower back pain with this. So already they diagnosed. They went to different specialty and physiotherapy, chiropractor, a lot of things they they did, and still the patient has pain. So that's why the patient she came over here, and the pain reported began after wrong sleeping posture and exposure to the cold environment work, because she is working in the factory, and so often she has to go inside the cooler room and come, right? That kind of the company she worked, and pain extend from gluteal to the hip, then thigh, and it goes to the down to the leg, and also with numbness on the right leg. There's a sensation, formication sensation, like ants graveling through the right leg, inside the leg. That kind of sensation she has. And general sensation like weakness in the back, the back and both lower limbs weak. So sleep disturbed. So this is the presenting complaint. And the character of pain, just I explained, sensation of pain, sharp, sometimes stitching, stabbing pain, right? numbness, then the sensation like graveling and ants graveling like sensation. So the aggravation, sitting, lying, lying on the painful side, especially on right side, then prolonged standing, because her work also like that, right? Lifting weight and because of the Canadian weather, right? Often the weather change, especially in the winter time, right? The pain aggravates. Cold exposure, exposure to cold. The pain ameliorate by pressure, walking, and warm applications. Right. And the associated symptoms are like the same thing, like weakness in the back, weakness in the both limb, craving for sweets, thirstlessness, sleep disturb, and also the post-menopause. The problem came after the menopause. So this kind of history she has, and the case analysis. So I took all these symptoms, the important characteristic symptoms, and I repertorized, right? So this case I repertorized through the Murphy repertory. You know the Murphy, right? Here that is one of the important repertory, right? Often I use this type of cases, the deep pathology cases. So, so the carbonicum. So I prescribe 200 potency of calicarb, right, in a different interval. And within a week, patient starts reducing the pain, relieving the pain. And until 1 month, I prescribe this medicine, right, daily doses for 1 week continuously. Then next week, interval doses. Then the third week, like that. Then I advise her some kind of massage and exercises, right? She can do it at home. So slowly she came out from the pain. So that is a very interesting case. The Calicarb is the one of the, because when you see the mind and the interesting features of this case, and the Calicarb is one of the important remedy. The next patients, that is a different remedy. The other patient is different remedy. So I'm going to show different remedies, how it's work in the similar symptoms. The Calicarb, one of the best remedy for sciatica and various, respiratory problem and various kind of things. But this, the story of these patients, that's very important, right? Mentally, the mind symptoms of the patients, right? She always needs support. She always need support from the family. She always need seeking the support from the group. She always family oriented. When they came, both husband and wife, that time she always complained about husband in front of me, started weeping and crying and complaining about the patient, so the husband. You know what is a complaint? So he doesn't support me in various aspects, right? I'm alone. I feel alone. I feel forsaken feeling. I feel abandoned. No support from my family. So this kind of, this is the Calicarb peculiarity, right? This is mental support. And also physically, the Calicarb, when the patient came to me, and for few minutes, he just sat on the seat, and he just get up and see, he stand on the, right, close the door, So like that. She needs, she wants support like that, right? On the backside because of the pain. The pain also, she wants support. Always, even while sitting or these things, usually she used to sit in the floor and leaning on the wall, right? So always she needs support. So physically also and mentally, see how it's correlate. That is the Calicap, the real picture. So she always consider, usually regularly, not only this patient, the Calicap mind, they always consider the health of the family, the members of the family. When they sick, the Calicap patients, they become anxious and fear and right, these kind of symptoms. They seek always support. Because of that, because of not support from the family, the Calicap patients always quarrels with the fighting with the family members. Those who are close, to her, they always fight with them. Nagging, nagging, right? The most of the Calicap patients, I think, nagging, right, with the husbands and right, complaining always. So most of our Indian and Sri Lankan type of women, right? They have because they are family oriented. That's why, right? They even Jan Scolton explained, right? Most of the Indian women have this kind of right. They need Calicap and Calicap because we have the building oriented family, right? Because it's a mineral. Calicap is a mineral remedy. Always they need minerals always have relationship. Mineral remedies have most relationship oriented, family oriented, the society oriented. This is a mineral, the character of the mineral remedy. What about the plant remedy? Plant remedy always sensitivity. They always focus on sensitivity. And the animal character that is different, right? As Rajan Shankaran explained, survival, competition, survival and competition in nature. But here, the Calicap is a right. And very interesting thing I want to tell you about the Calicap. The Calicap patients, they always fight with the doctors, but they won't go right. They always believe us, and they always with us. If you are cured or not, if you are not cured, there no problem, doctor. I believe you, and they worship usually they worship they worship the doctors, right? And also very important things I want to tell you, Calicap patient, they bring more patient to you. If you cured or not, no. They won't worry about that, right? They lean on you and right, they just they stand on you and they refer a lot of patients. So that's why Calicap patient, if one patient comes, right, right, it's okay. That kind of they bring more patient to you, right? Now we'll come to the so this patients also really, this patient came to me, this the case which I explained, he came to me, it's about few months ago, maybe in the month of March or April. So after that, you don't believe, she recommend 3 or 4 patients. They are not the same kind of problem, but even the other right issues. And I will come again to the pathology. Sorry, the slide. Okay, here, is it visible, sir, Dr. Danish?
Yes, visible.
Visible, okay. Okay, here you can see the nerve innervation of, why I am showing all these pictures, right? You know why? Because if you know the exact, the problem, because every area belongs to the root of sciatic nerve. You can see the red one, it is S2, compression or pathology in the S2. You can see the the other, the pink one, right? The pink one S2, and the brown one, see, that is S5. So like that. The green one, you can see S1. So patient, most of the patient, they won't tell you this is a sciatic case. No, they won't tell like that. So they just explain, I'm having pain on this side, the medial side, sorry, the lateral side or medial side of the leg, or in the heel region, or in the lateral side of the foot region, right? So it may be there's no history of back pain, or there's no history of pain in the gluteal region. Only they feel the pain over here. So they think that there's a problem in the leg. No, there's no problem in the leg. Actually, in the nerve root problem, right? So that mimic, that express as this kind of, so very important. Here you can see the same sciatic nerve branches, right? Then it become a superficial perennial nerve and saphenous nerve, sural nerve, the medial plantar nerve, lateral. So this kind of things, even in the dorsum and the plantar view of the foot, they may have pain. That may be the sciatic pain, the extension of the sciatic pain. So most of the people, they think that, oh, the pain in the feet may be the problem in the plantar fascia or the arch, or the exactly on the feet, exactly on the toes, exactly on the heel. So these symptoms may mimic like right like that. So, and the other, most of the patients comes with me with a piriformis syndrome. I think many of you heard about piriformis syndrome or the wallet syndrome. Do you heard about the wallet syndrome? So most of the patient, they keep the wallet here in the behind, right? Over here. See? Right. This wallet, this kind of wallet, that's called wallet syndrome, because the wallet compress the nerve, the compress the piriformis muscle, and that continuous irritation of the piriformis, the muscles to the sciatic nerve, it may cause the sciatica. It may mimics as a sciatica. Here you can see the wallet syndrome. You can see, right? So better you have to ask the patient whether you maybe, right, so you have to ask all kind of things and ask them to remove all or avoid all kind of things. And so what are the causes of the sciatica, right? Before we go into the second case, so we'll little discuss about the causes of sciatica, right? There may be piriformis irritation, or the spinal stenosis, or the herniated disc. These are the three most important, right? The herniated disc may be due to injury or lifting weight or slip and fall, maybe different history. And spinal stenosis due to various causes, right? So the causes of sciatica. There are more than 10, 12 causes like lumbar disc prolapse, degenerative disc disorders, lateral recess stenosis, and neurofibroma, and the other tumors may compress. Okay, then epidural abscess or piriformis symptom, I explained, diabetic neuropathy, iliotibial band symptom from here, right? The pain. So like that. And also generally other leg pain, other problem that may mimic as a sciatica, right? That's also, I explained, like maybe other diseases like here you can see, I'll explain. See, the pain in the leg. There are different pathology. The most of us, we think that when the patient come with a pain in the leg or both leg or one leg, right? Sciatica. We think that always. No. There are some vascular pathology behind that. Arterial disease, the venous pathology, it's where, especially the more common problem, deep vein thrombosis, right? Varicose vein. And the post-thrombotic syndrome. So these are all like mimic like sciatica, aortic embolism, maybe thrombosis. This is the vascular. Then any musculoskeletal problem, that's also mimic differential diagnosis, we can say, right? Myofascial pain syndrome, myositis, right? Muscular strain, muscular sprain, trauma, maybe fracture, osteomyelitis of hip joints, hip pathology, right? So, and even neurological causes, peripheral neuropathy, chronic diabetic, right? Peripheral neuropathy. Some deficiency, vitamin B12 deficiencies may, right, irritate the nerve. Then lumbar radiculopathy, lumbar disc prolapse, spinal stenosis, so different kind of other pathology also. Some infectious pathology also we have to look out, right? Cellulitis, abscess inside the abscess of even in the popliteal fossa. One case, they treated, right? Then after that, the patient came, abscess in the popliteal fossa, and also the Berger cyst. You know the Berger cyst. There's a small fibrous fatty tumor appears in the popliteal, just inside the popliteal fossa. So it also compress the nerve and mimic as a sciatica. So that's kind of different. And some metabolic disorders, hypokalemia, hyperkalemia, hypocalcemia. So like that, magnesium deficiency. Most of my patients, whenever they come, I prescribe calcium, magnesium, along with the homeopathic medicine, supplements. Right. Now we'll go to the second case. Yeah, another guy, gentleman, 32 years old. This is a recent case. Within 2-3 weeks, right, the patient completely all right. Because it's only 3 weeks duration case, right? So 32 years old male, sciatica, sleep complaint, sudden onset. And this is a very interesting cases. I'll explain you how it started and all these symptoms you can see here. The pain, right-sided sciatica, right? The patient he said, like being stabbed with a knife, right? Just behind the muscles, beside the muscle, inside the muscles, right? That kind of sensation. And also the patient has sensation, right? Sensation as through something sharp or pointed material stuck in the popliteal fossa. So I never ask him. Generally, I ask him just what kind of pain, what kind of sensation, what kind of feeling you have in the painful part, in the painful area. Then sensation, as he said, screwdriver, screwdriver. I feel like the screwdriver screwing with a nail with a screwdriver. That kind of sensation. So immediately, everyone, you are familiar about this after my lecture, right? Sensation active. So for this patient, I referred this book, right? The other, even the the Murphy repertory as well as the sensation active chair robot, right? So see, these are the other symptoms, and also this patient, very interesting pathology as well as here you can see modality, right? Sitting aggravations, lying aggravations, even walking aggravations, right? And also stretching. The patient is a stretching relief. I ask him, when the patient lie down on my bed, right? I ask him, oh, when you get severe pain, intolerable pain, what do you do? He said, see, like that. You can see like that. Right? Like doubling, bending, doubling like that. Stretching. That. So what is the remedy? Anyone? Anyone? What's the remedy?
There is Korea.
As Korea also comes. That's any other remedy? I'll cover. Okay. Here you can see the mind of the patient. This problem actually starts some psychological background he has, anger and vexation. You know why? What happened? He's on temporary leave until the issues, because there's a problem with the superior. So they were quarrelsome and fighting with the. He's working as one of the senior engineer in a company, and working with a some IT guy, I think. There's a problem, right? Argument with his superior, and just he get out from the office, and he sent a letter, right? I need a short leave and all, because of something is happened. He didn't explain what happened, and because when when he explained that story, he got emotionally disturbed. Lot of disturbance I can see, right? So that may be. Then what is the remedy? Anyone? Suppression of anger and vexation and right.
Awesome.
So these are the symptoms, right? The repertorial totality, and finally the remedy, colocynth. Okay. And pathology also, right? They are, and the colocynth. That's one of the interesting case. According to the Murphy repertory, see, I can see the leg shooting pain extending down to the sciatic nerve. There's a rubric. He mentioned about the sciatic nerve. Shooting pain, excruciating shooting pain, extend to the sciatic nerve. The colocynth and ruta. So I gave colocynth. So this is a very interesting, the other case. Then we will come to the slide, the other slide. Mm-hmm. Okay. We discussed about the causes of sciatica and all these things, and the wallet symptom. I want to show you this one. Right. The picture is visible. Right? Anyone? Visible?
It is visible.
Okay, well, thank you, doctor. You know, I asked the ChatGPT AI, right? The AI technology. I ask the AI, please give me a right pain in the leg, regional interpretation with the homeopathic remedies. Just I type in the ChatGPT, right, and AI. So it gave the picture. You can see, very interesting. Even you can try, right? A lot of things you can do through the AI, through the right now the upcoming technology, right? So very clear picture. So most of the remedies you can see, right? in sciatic cases, right? See this also, see the remedies and the pain and area, location, sensation, modality. So in case of sciatica, these three things are very important in homeopathy, right? Everyone know location, sensation, what kind of where is the pain, where is the more pain, how is radiating, where is extending and radiating and all right moving. Some patients they are wandering pain from here and there. And sensation, what kind of feeling, what kind of most of the patients they say pain. No. You have to ask them, sit very quietly. You have to sit and give them for 5 minutes. Ask them, tell me what kind of sensation you feel apart from your pain. Then they will explain. Oh, doctor, this kind of thing and burning and right moving, something like that. They'll tell their different stories. So from that, most of the stories, if they explain, right, 90% of the sensation that is in the repertory. Right? 60-70% of the sensation you can see here, right, in the sensation acid. Easily you can select the remedy. So location, sensation, and modality. So here AI, ChatGPT, right, gave me a nice picture on the basis. The lot of remedies, but don't depend on this. But for the purpose of right knowing. And the other ones you can see here, right? This is also I got it from ChatGPT, AI. So how we the AI explaining, right? Homeopathic remedies and location, sensation, and modality. See, very interesting. And also this picture also, see, I asked the AI, please provide the sciatic pain regions, homeopathic interpretation and remedies. See, everything is there. Most of the symptoms, most of the popular remedies are there. See, you can see here. And this is very important. The another, right, before going to third case, I'll explain this one. This is the book, right? I think many of you, right, not familiar about this book. This is a repertory of back, leg, right, and the pain, different kind of pain. See, this is a very small. I think I forgot to take. Maybe next time I'll show you the book. Okay. Here you can see how the pain radiating and extension, right? Different remedies. Here you can see the calibike. The pain from where? In the sacrum, and it goes down in the middle of the thigh, calibike. And little laterally, oxalic acid. Then hepasal. So they are like that. There are berberis. Berberis is just from there, from sacrum to, and it's going to towards in front abdomen. So like that. Okay. Then we'll go to the next case. So this is a different case. A lady, female patient, 38 years, okay, 38 years old. He worked for the Amazon company as a delivery worker. The pain, duration of this pain, 1 year, right? And chief complaint, sleeplessness, severe low back pain and both sides, bilateral low back pain. predominantly more on right side. He is currently under sleep medication and painkiller. So low back pain, all the symptoms are here. You can see more marked on, more particularly on right side, and aggravates while walking, even driving, because he is a delivery person, right? So coughing and sneezing, ameliorated by lying on back, firm support, and hard and firm pressure. So like that, the symptoms, these are the symptom patient explained. Right. Emotionally, here also this emotional, because I took most of the symptom from the mental picture, emotional picture. Since father death, right, approximately about 1 year ago, that her father died in Sri Lanka because of age and, right. The problem is she is unable to attend his funeral. So persistent grief and guilt, right, cries while narrating all these symptoms in front of me. Weep. Usually patient weep when praying, and right, states, no one love me and I feel abundant. Right. The only person who loved me was my father, and right, now he died. Right. So when I go into little deeper into the mind, the patient started explaining all these kind of, right, very affectionate with the family, and right. So the other symptoms also she has severe burning and epigastrium. They diagnose as gastritis, chronic gastritis, diagnosed as a gastroesophageal reflux disease, burning erection after eat, severe thirst, frequently drink warm water, and the other symptom which I observe, weakness and irregular menstruation and anemia, right? So these kind of symptoms. So mental, emotional, right, rubrics, the key symptoms, keynote symptoms, then physical, some keynote symptoms, right? You can see, and mental general, grief, prolonged ailments from death of the loved one, right? Guilt and unresolved grief because of his father. She is unable to attend his funeral, the father's funeral. So weeping alone. Continuously, it irritate that incident, right? Guilty feeling. So that is the main, so the picture of this case. And after that, the rubrics. I repertorize this case through the complete repertory, right? See, you can see. So what is the remedy? Finally, natamur came. So usually we don't think natamur cures sciatica. Yeah, it cures sciatica. Right? The first case, calica. Second case, the colocynth. This is a natamur. So natamur cures the sciatica. Because the first case is pathology. Second case also pathology as well as the mental picture. But this case, only the mental symptoms, right? The cause, the main root cause. So find out the root cause and treat the patient, not the disease. Treat the patient, not the disease, right? That's why we learn. And there are, in my experience, these are the three cases. Before going to the question answer Q&A, in my experience, there are some books I wanted to show you. For this one, Lilienthal Homeopathic Therapeutics. right? More, whenever the painful cases or this type of cases come, and the other books which I always having, see, the handbook of homeopathy, practitioner's handbook of homeopathy by Dr. Merani. This is a very old book, right? So I used to refer this type of cases comes. So Naphthalum, I think how many of you heard about Naphthalum? That is a sciatic remedy. Many of you know, right? Here in Naphthalum, sciatica with the same picture, but mainly, repeatedly the patient says numbness, numbness, numbness. So numbness where? In the lower limbs, right? Mainly in the feet. It looks like it's right, the neuropathy. It's not the neuropathy, but it's a real Naphthalum cases. And colocin I explained, and another remedy, sciatic ranunculus bulbosa, right? I think many of you know. And lecaninum. Lecaninum is one of the best remedy I used to prescribe. Right-sided, feel stiff and numbness. They are Naphthalum only numbness. Here, stiffness and numbness. These are all some clinical tips which I am going to give. But the lecaninum, shifting pain, wandering pain, from move to one place, from hip to back to hip to thigh, then sometimes thigh to feet, like that. So pain is moving from one place to another. And calmia. Calmia is one of the best remedy, right? For sciatic shooting pain, downward with numbness, shooting pain. And calibike. Frequently, I prescribe calibike for this the sciatica. Very rapidly, indication is rapidly shifting one place to another, quickly, wandering pain, but relieved by motion. That is calibike, right? And the other colocin I explained, and tellurium. Tellurium is one of the best remedy often I used to prescribe. But here, the tellurium, it like a phosphorus, it work on the spinal cord itself. Very sciatica with very sensitive sensation, sensitiveness in the spinal region, in the spinal cord, in the lumbar region, spinal area. Right, that's a radiating pain from sacrum to right-sided. Tellurium always right-sided remedy, and pain worse like while lying down on or while lying on the painful side. And very important, coughing and sneezing and laughing, the pain aggravates. That is tellurium. And bryonia and other remedies also there, but right on motion. But here, very important, tellurium, coughing.
You're muted,
Please
sir.
unmute.
Please unmute. Please unmute.
Okay?
Okay, fine.
Just now it's muted or before?
Just only. Just
Okay.
only. Few seconds.
Okay. Sorry. So when the tellurium picture interestingly, you have to ask the patient to take MRI and all kind of things. Maybe there's a spinal injury, history of spinal injury. So you have to rule out that, right? So slip and fall history, if it is there, then you can prescribe the tellurium. That's called deep. So this book, Merani, he explained that, right? Deep sciatic pain. Deep sciatic pain, right? That is a tellurium. So these are all most of the things I explained. And Any question? Another 5 minutes. We can discuss about some question answer.
Yes, thank you, Professor Paul Joseph. It's really a very good session. You really show three brilliant cases and how homeopathy works. As you rightly point out that it doesn't matter whatever be the case. You look at the patient, find the symptoms, choose the right medicine. That's what homeopathy and homeopathy. Unfortunately we are prejudiced, and that's the reason why we may think that it's a good medicine for that particular. But in all the three cases, we have three different medicines comes. So that's how we can go ahead. In all those conditions, the symptoms varies from each one to other, and the cause also varies from different situations. That's the reason why the second case it was Colossin, and the third case, and in one case it is Calica, where mental symptoms are prominent, but also the physical symptoms also came in the same way. Anyway, the time for discussion, only few minutes remaining.
Any questions?
Yes,
Please.
Dr. Abrasius. Yes, please.
Thank you, Dr. Dhaneji. Everyone, namaskar and congratulations, Dr. Joseph sir. Very nice, excellent session. Describe the sciatica remedy according to symptom. But sciatica due to trauma, arnica is the best remedy. Hypericum is the best remedy.
Yeah,
Idapal is the best remedy. Due to trauma. So sciatica. So,
Arnica Ruta always in the first. Yeah.
Generally, homeopathic medicine Polos is the best, Nephilium is the best remedy, Calicar, best remedy. According to mental symptom and according to repertory, different types of medicine. Like my experience, Polosin and Nephilium is the very good remedy. And according to mathematics,
Yes, sir. Sir,
Sora, psychical nature, according to Gotti and according to arthritis, psychical nature, mathematic, so psychotic nature. So medorinum is the best remedy. Only one dose medorinum. Thank you. Very, very thanks. Ghargar
Yes,
Homeopathy, Ghargar Homeopathy.
I'm inviting Dr. Manoj to say a vote of thanks to the session, as there is already. Yes.
Thank you.
Hi, Dr. Manoj.
Yes,
How are you?
Yes, I find the nice presentation. As always, there is no doubt about your potential and the way you are crafting the cases. So, on behalf of IFPH, I am expressing sincere thanks to Dr. Paul Joseph and all other participants in the session. Thank you.
Thank you. Thank you all.
Thank you, Dr. Manoj, Dr. Amberesh Susal, and those who attend the English session today, and a very warm thanks as well as congratulations to Dr. Professor Paul Joseph for coming over here and delivering three cases and presenting three successful stories here. Thank you all. Good night. Tomorrow we will have a session from Dr. Gopal Chawda, and he's a PhD scholar, and we'll be talking about Beyond the Lesion, decoding acne vulgaris through homeopathic perspective. Over to Dr. Maria Majon tomorrow in the Malayalam session.